Hi class, this is Tess Garland, and we're going to be discussing data sets and information management as it pertains to the nursing healthcare setting. So in today's dynamic healthcare system, technology plays an important role in education and nursing work. So it seems only necessary to study the role of nurses and highlight the need for appropriate information technology educational programs to integrate with the ever-increasing pace of technology. Many aspects such as data recovery, ethics, patient care, decision support systems, human-computer interaction, information systems, imaging informatics, computer science, information science, security, electronic patient records, intelligent systems, e-learning, and telenursing have been added to the field of nursing of informatics. Specifically, data sets. So what are data sets? So basically a data set is a collection of data. In healthcare, this includes medical data, various measurements, financial data, statistical data, demographics of specific populations, and insurance data. Nursing minimum data sets represent the first attempt to standardize the collection of essential nursing data. These minimum core data are used on a regular basis by the majority of nurses in the delivery of care across settings and can provide an accurate description of nursing diagnoses, nursing care, and nursing resources used. Collected on an ongoing basis, a standardized nursing database will enable nurses to compare data across populations, settings, geographic areas, and time. Public health nurses will be able to evaluate and compare services utilizing these data sets. So a few examples of the data sets would include the healthdata.gov, which includes data that has to do with claim level Medicare data, epidemiology, and population statistics. A second example would be the WHO, so the World Health Organization, which provides data and analyses on global health priorities and including health and disease statistics. Third would be the Open FDA, which includes reports on the adverse events of drugs such as side effects, product use errors, product quality problems, and therapeutic failures. And a fourth example would be Medicare.gov, which includes available databases including the drug and health plan data, a Medigap data, and Hospital Compare. So that brings us back here to the main page. And with rapid explosion of the nursing knowledge worldwide, the amount of data nurses use and process in the delivery of care is extensive and often unmanageable. Advances in information management and computer technology have broad implications for this knowledge explosion and can facilitate the collection, manipulation, and retrieval of essential nursing data for practice and research. So that brings us to our information management, which is basically a collection, analyzing, and maintaining of the data that doctors, nurses, and other healthcare providers rely on to deliver effective and skilled healthcare. So data for decision making incorporates all aspects of healthcare. Included in informatics is nursing science, information science, and computer science. With rapid advance of informatics and healthcare, a variety of professional organizations have confirmed the need for students to rapidly learn about informatics. There are many benefits to the electronic information systems, and these would include documentation. So documentation for safe practice obviously is preventing errors in patient care, which is a major concern. This is also quality improvement, which is providing quality care that's enhanced by reflecting on info about the practice. It is team communication, which is information systems that promote team communications. So maybe sharing of labs between, the hospital lab and the units on the floors. This is also decision support, which provides opportunities to monitor and support nurses' clinical decision making. And finally, this is monitoring, which provides opportunities for monitoring data, patient data, and trends over time. So when we look at putting it all together, the recent advancements in information technology and computer science have led to the development of computerized information systems in different areas. So in healthcare, these systems, known as healthcare information systems, are used as supportive tools to facilitate clinical and administrative tasks. These systems can help to minimize errors, reduce costs, and improve the delivery of care. So nursing information systems are among the key components of healthcare information systems, and they can help nurses to use data more effectively while managing their nursing activities, allowing them to improve patient care and develop their knowledge. So there's also, at the end of this presentation, there's a quick video that we can watch. And I'm not sure if I can get that to play. That concludes my presentation of data sets and information management. Thank you.